Good morning, 1027, 1035, WICY, your feel-good tunes of the 80s and more. It's John Kazar with you, joined by Matt Jones of Alice Hyde Dental Center. He's a chief operating officer there. Joins us what seems to be about every other week, right, Matt?
Yes, sir. It's been fun to get the time with you.
Yeah, well, no, every couple weeks is perfect because I think by that mark, there's always something updated or happening with you guys. And I think today we could talk about the dental center reopening, huh?
Yeah, so we've been looking at the dental center for quite a few weeks now. It's actually probably been one of our more difficult services that we've been talking a lot about, and we're working on opening up our dental center to doing all of the procedures that we're able to do prior to COVID. So we've been able to do that, but we're doing it in a limited capacity right now. Part of the reason is because for dental procedures, they're all considered aerosolizing procedures. So that means that there's particles from each patient that get put up into the air. And what we need to do is actually, if you are working in, and not to get too technical, but if you're working in certain procedure-type rooms, you need to let those aerosolized particles kind of settle down to the ground and to the surfaces so they can be wiped down and sanitized properly.
Big step here, though, Matt, right, when you allow this to happen.
Absolutely. And it's we want to make sure that we're doing things properly to keep the patients safe and our staff safe, to make sure that we're sanitizing properly and everything is safe for dental procedures.
Yeah, no, and I understand it's very intricate work, but there's a lot of studying that has to go behind this stuff, right? We don't want to make a false move. I think
no, we want to make sure that as we're continuing to reopen services, that we're doing it in a safe and effective manner. And one other thing that we're doing, that we're putting in place to try to help out with our capacity in the dental centers, we're ordering some new specialized dental suction equipment, which really capture over 99% of the aerosolized particles. Obviously, right now, because of COVID, this type of equipment is in high demand. So we have them on order, and we'll be getting them in soon, and that will help us be able to increase our capacity. But we've definitely appreciated, kind of the community's support and understanding that as we do things with sometimes limited capabilities in the amount of appointments that we can set up per day, we've definitely had some great support, and people really understand when we're talking to them on the phone, that we're trying to do things safely, and they appreciate that. So we appreciate the support that we've been receiving as we open up slowly.
Sure, it's been very encouraging. And Matt Jones with us, the Chief Operating Officer at Alice Hyde Medical Center. And is there anything else that you want to add, Matt, as we have you here today?
No, I think the only other piece to kind of conclude with on the dental center piece is, obviously we know dental hygiene is a huge piece of a person's overall health. So we want to make sure that we are able to provide that service and that we can do it in a safe manner again. So we're working hard to do that, but we have definitely appreciated the community support and their patience as we move through this process.
That's what it's all about. All right, Matt, thank you so much for your time today, and we look forward to speaking with you again soon in another update.
Thanks, John. I appreciate it.
All righty. 1027, 1035, WICY, feel good tunes of the 80s and more inside the community with those at Alice Hyde.